11:30 on my clock. So good evening and welcome to our third bonus session. I am joined with Jake and Justine, who are two students at the University of Nevada, and this is our PA student panel. This is just a reminder that this session will not count as foreshadowing hours, and a quiz will not be followed as well. And if you haven't done so already, please check out our Instagram and join our mailing list for more updates on upcoming sessions. And if you have any questions, feel free to email us at virtualshadowing@gmail.com. Here is our working group. It consists of Reagan, Cheyenne, Taylor, Ali, Rachel, Miriam, Elena, and Ruth Rohit, myself, Aditya, and then our primary physicians are Dr. Fowler, Dr. Machete, Dr. Salazar, and Dr. Reno. And if you've been following us this week, you know that we have had a very busy week, but tomorrow is the end of our crazy week, and it will be a PA spotlight in orthopedic surgery. Then the following week, we'll have a nursing spotlight in med surg, and finally, it will be July next month, which is crazy. And so we'll have a PA spotlight in acute care and surgery. All of these sessions will start at 7 p.m. Central Standard Time, and feel free to join on Zoom or YouTube Live. And if you're unable to, these sessions will be posted on YouTube Live the following day. And unlike our regular sessions, we're just going to have one big Q&A at the end of this meeting. But feel free to put any questions you have in the chat, and we'll make sure to get to your questions as soon as we can. So without further ado, I'm going to hand it over to Jake and Justine. They're so awesome, and I'm so excited to see what they have for us today.
Awesome. Thank you so much, Kiana, for the great introduction. Like she said, my name is Justine and this is Jake. We attend the University of Nevada, Reno, and we're first year PA students. We're about to be second year PA students in about a month here. We're super excited to be talking to you all today. And if you can move on to the next slide, Kiana.
Yeah, thanks for coming to this, guys. We're super excited. We got to talk with a few of your peoples here before we started, and we're glad to have the opportunity. So I'm just going to kind of start with the general PA journey, just so you guys have a roadmap of what it is to become a PA student and PA essentially. So it is similar to applying to medical school. So it starts at undergrad, and you're going to want to focus on things like your GPA, hitting the books, making sure you're doing well in classes. Next is a bachelor's degree. So all PA programs, as far as we know, do require a bachelor's degree. And the cool thing about this is you don't have to be a biology major or chem major or science major. We know art majors that get in, English majors that get in. And honestly, having a unique major is actually helpful for your admissions. And then, of course, you want to be participating in undergrad activities like intramural sports, pre-health clubs, any volunteering that your school might be offering. So those are things to consider there in undergrad. Now, some people do this next step during undergrad, but also after. It really just depends on your schedule, but PA shadowing. And for admissions, some schools do specifically want you to shadow PAs. But for instance, our university didn't mind if you shadowed an NP or MD or DO. They do prefer PA shadowing, but any healthcare provider really works out. And you can do this in a hospital, in a clinic, and we've done both. Next is patient care experience. Now, this might be one of the biggest things that set apart applying to PA school from other programs, is that most PA programs really look at your patient care experience prior to applying. Now, this includes work like scribing, medical assistant, EMT, CNA, all these different patient care experience hours that you can obtain mostly, and these are usually paid hours. So we'll get into different roles and different jobs you can do prior. After that is the GRE. So instead of the MCAT, a lot of PA programs require the GRE, others don't. And we're going to get into some studying tips later, but yeah, so you do want to make sure you get that if you want to apply pretty broadly. Now, after you get all those steps done is the big fun one. You're going to be applying through what is called the CASPA. And so this is where you're going to want to write your personal statement, you'll get your letters of recommendation, and you're going to want to upload all of that information you've done about you, about your GPA, about like your classes you've done, very similar to like the AMCAS or something like that. After applying, and if you are granted an interview, which is, always the wipe the sweat off your brow kind of situation, you're going to want to make sure you're ready for a PA school interview. And we have a couple of interview tips lined up and just common questions that we ran into and common themes. So yeah, in general, this is how it looks to apply to PA school. So Kiana, you can go on to the next slide. Justine's going to talk about our specific journey.
So we're going to start off by talking about our specific PA journey, just so you guys can get an idea of what we did prior to applying to school. It starts in undergrad. So we both have bachelor's degrees in biology. And the interesting part of this is that we both actually started off as pre-med students. And I think what you'll find if you know anything about the pre-med path is that it's similar to the pre-PA path. What's important in undergrad for both these routes is getting your extracurricular activities in. So Jake and I were both a part of pre-health organizations. I was an officer of Alpha Epsilon Delta, if you guys are familiar with that. It's a pre-health honor society. That's what I did in undergrad. We both, yes, AD. So yeah, we both volunteered as well in undergrad. We volunteered for different organizations. I know you volunteered in the hospital. I volunteered at a free clinic. So that was a little bit of our volunteering experience. And we both, during undergrad, shadowed. Jake talked about this a little bit earlier. We shadowed both MDs and PAs during this time. And then after undergrad, which we both graduated in 2016, we took about three gap years before actually putting in our application to PA school. So this is the time where we really kind of figured out that we wanted to do the PA path as opposed to the MD or DO path. And this was partly due to, our experiences working as medical scribes. So I was working in the ER as a medical scribe, and then eventually I moved on to scribing for a women's health clinic, which was amazing and it was so fun. And that's where I eventually became a medical assistant. And that's where I got a lot of, the patient care experience and the patient care hours that I needed to apply to school. Jake did a post-bac. And if you want to talk about that a little bit.
I kind of want to just plug this a little bit for especially anyone who's interested in applying to like graduate school, medical school, PA school. A lot of people have the notation or like this connotation that going back for a post-bac means that you might be dumb or admissions might look down on it. And I just want to let you know that that's not the case at all. And in many cases, they look at it like, hey, you are dedicated. You're willing to come back to school and get your credits and get the required courses and increase your GPA. For me personally, I went back because when I got my bachelor's in biology, I didn't complete the right prereqs for PA school. Once again, we were originally pre-med. So I went back, I did 2 semesters and hey, it bumped my GPA as well. So that ended up looking good on my application. That was just a little plug there from me.
Right. And then in our gap years as well, we did some more shadowing. So more shadowing MDs and PAs. And that really helped us decide like, oh, this was the route that we wanted to pursue. Mm-hmm. And then it came to application. So during the time we were applying, we continued to work. And the CASPA application, which is the application that you're all gonna have to fill out to apply to PA school, that usually opens in late April. So once that opened, we started to work, and this was around April 2019. We were able to get our initial applications in by early July, and it's important to pay attention to deadlines here because a lot of schools, they have rolling admissions, and the earlier you apply, the more likely you are to get an interview. So those are some things to pay attention to when you're applying. But we also submitted our secondary applications by September, and I think around mid-September, we started to hear back from schools as far as interviews, and we actually started to interview in October, and throughout that whole winter, we started to interview. So that was the application process for us. And if you can move on to the next slide, Kiana, please. Jake will talk about a little bit of healthcare experience versus patient care experience and shadowing.
Yeah. And we see all your guys' questions popping up in the chat, and we promise we'll try to get to as many at the end. I've seen a couple and they're great questions. So here's a piece of information that I wish I knew before I started applying, is the difference between healthcare experience and direct patient care experience. So there's HCE, PCE, and then shadowing, right? So what counts, what does everyone look at, right? And so to define that a little bit better, healthcare experience is any job or experience you've done that just works in medicine. You can be someone working up at the front desk, you can be a phlebotomist, you could do anything that works in medicine. You could be a port transporter, anything like that. And so they look for those hours. Now, the other thing that PA schools look for is patient care experience. Now, this is where it gets a little dicey, I guess. They want to look for positions that you've worked in that where you directly interacted with patients. Now, Justine was a medical assistant, and so day in and day out, she's taking their vitals, she's doing procedures with them, with the doctors and the PAs and the NPs. And I didn't have that same experience. I was primarily a medical scribe, and in many situations, the scribe doesn't have any contact or conversation with the patient. In my capacity at the job I worked, I was kind of a quasi medical assistant and quasi scribe. So I was able to kind of, I guess, double dip, if you will, but I did directly work with patients. And, that's, I think the important thing to remember here is look at the program you're applying to and look what they take as direct patient care experience. There is a program we're aware of that took scribing as half credit. So let's say you did 1,000 hours of scribing, they would count that as 500. So that's something really important to look at before you just like send your hours in. They might say, oh, nope, that's either 0 for us or it's half or full credit. So really look into that. Attached here, we actually added from our class profile in Reno at our program. These are some things that people did prior to applying, getting accepted, and applying and getting accepted to our program. So I think a couple cool ones here are like there's registered nurses, flight paramedics, Army medics, like, PT techs, athletic trainers, EKG techs, all these cool jobs that you get to work directly with patients. One guy in our class, and I won't mention his name, but he's awesome. He's a doctor of audiology. So he went to a 4-year doctorate program. He practiced for 9 years as an audiologist, and he is insanely good at anything that has to do with ears. And it's just like, he's a great resource for us. So I always like to plug his story. So that's mainly the healthcare experience versus patient care experience. And then the shadowing, we kind of touched on it before: hospital shadowing, clinic shadowing, and virtual shadowing. We were speaking briefly before starting here. I think this is definitely going to be something that a lot of programs are going to be moving towards and seeing that is a viable option. And we're impressed by it already. So yeah.
Jake, one of the things I'm trying to do is get the feel from different medical schools and PA schools as far as what they would be looking for about online shadowing. And so far, it seems pretty positive.
Yeah. I would actually be interested in talking with our program and seeing what they think about it. And I mean, I think they're going to be pretty receptive because you get a lot of great experience from these sessions. So yeah. But that's pretty much what we had there. So Kiana, you can go into the next slide, please. Thank you.
Right. So now we're going to talk about a few interview tips we have for you guys. So our first tip is to figure out your why, not only for your personal statement, but for also your interviews. So figuring out why you want to be a PA and why this is the path you want to go down is super important for your personal statement. And it'll definitely show during your interviews as well, because, this is a common question in interviews, and Jake will talk about a couple common questions in a little bit. But when interviewers ask you, or when admissions panels want to know why you're doing this, they can kind of see through like the very superficial answers. And it's really important to have a reason and a really good story behind why this is the path you chose. So we recommend figuring all of that out before you even submit your application, and while you're figuring out your personal statement, because that will really make you shine. Next, our next tip is make sure you interact with all faculty and fellow interviewees, because you never know who has an impact on your acceptance or rejection. If you at your interview seem to be not really interacting or you're just not being personable with the other interviewees or even with the faculty, people will notice that. And I think it's important to really make the effort and try to interact with as many people as you can. The third one kind of ties in with that. We know that the interview process is nerve-wracking, right? And a lot of times we have the connotation that it's the best thing to be professional. But I think that the more personable you are, I think that interview panels and admissions committees really want to see that you're a real person and you're not just a robot. It's great to have all these perfect answers and, it's great to have all these perfect experiences. But I think the thing that sets apart PAs is that, people have great experiences with PAs because they're personable and you can actually relate to them. So that's what admissions committees and faculties are really looking for, is just making sure that you're a real person. The fourth one is, remember that you're also there to impress. You're not just there to impress the program, but they're there to impress you. This interview process is not just for you to be like, oh, you want me, but they want you to pick their school as well. So that's something to think about too. They know that you're interviewing at a bunch of different schools and, they're there to convince you to attend their program. And then lastly, our last tip is try to dress different, but still be professional. So this is something we learned while we were after we had been accepted, and, we were speaking to our faculty and, they would talk to us like, oh, you were the one in the blue suit, or like they remembered us on the way we dressed or how we looked that day. And I think by setting yourself apart a little bit and still maintaining that professional look will make you more memorable in the long run. So.
Yeah, don't go in with a t-shirt or a nose ring, but try to stand out a little bit. So Kiana, you can go into the next slide, please. Awesome. So kind of transitioning to some common interview questions. And now they're not just going to ask you 3 questions, but these are going to be the 3 that pop up the most across PA school interviews. Biggest one is, why did you choose PA? It's a question that we get a million times a day on social media and from our friends and family before we started PA school, is why not just become a doctor, right? And so our reason is, everyone's reason is going to be their own, and we'll get into ours later on, I believe. But you need to figure that out prior, because they don't want to. There's one guy that I interviewed with. He said, "Oh, well, it's shorter," and it's that's not really a good answer and they kind of gave him a good look. And so, you don't want to give options like, oh, it was the easier route. So, and honestly, a lot of people do believe it is. And I would argue that it's not easier. It's not any harder. It's different. It's a whole nother pathway. So make sure you really figure out why you are choosing PA. Another great one is, how well do you work in a team? And this is crucial to the PA field. We're big believers in OTP, which I don't know if you guys talk about OTP in your programs or before, but optimal team practice. And what that basically is when you treat a patient, you have an entire healthcare team, right? You have the nurses, you have the doctors, and you have the PAs all working as a team, and plus everyone else that's involved in the hospital system, not just that. Pharmacy, I can go on a million different branches of it, but you need to be a team player to be a PA. You have to understand when to be a leader, and you also need to know when to step back. And they'll ask you questions that are based on this, and they'll also even make you do weird little activities. Like in our program, we had to do a puzzle with 2 other interviewees, and we're not allowed to touch the puzzle. You have to describe how to put the puzzle together, but they're blindfolded. It's kind of crazy. So they really try to figure out how well you work in a team. And then the last thing that stumped a lot of our classmates that did end up getting into the class, but we figured was the hardest thing, was they'll give you a scenario, or they'll ask you to describe a difficult situation. My situation was where I was a medical scribe, and I was typing out some x-ray findings. And I was also at the time kind of familiar with x-ray, which is x-rays. And I had noticed a fracture that the physician I was working with had missed. And so it's not my place ever to correct a doctor or give medical advice, but, I had to kind of I felt like I should step in at that point and say, hey, we don't want to just send this patient home without an issue. So it was a difficult situation because as a medical scribe that was working with a physician, I don't want to cross any boundaries. And so I had to I described that during my interview, and like the feedback I got back was that, yeah, that's an important and difficult situation you were put in. And how did you navigate it is what they're looking for. Not did you become the hero of the day? It's how did you navigate that difficult situation? Because you will, as a medical professional, run into hard situations like that. But yeah, so that's pretty much the common things we noticed across most interviews. But there is one little plug we want to make, and I guess we'll put it in the chat or something. There are a couple of resources you can purchase through like Amazon that PAs and I think, yeah, PAs have written, and it's like how to ace the PA school interview, stuff like that. And it has like a list of a bunch of PA questions that often come up. There's an odd one that comes up. It's like, what year was the PA field invented? And they really just want to know, like, are you invested in this field? So if you can get the right year, then hey, that's brownie points, I guess. So I thought that was kind of a weird one. Like, oh, if they're going to throw that at me, I don't know if I'm going to get it right. So, specific years. Kiana, you can go to the next slide. Thanks.
Awesome. So now we're going to touch on a little bit of the PA curriculum. So if you guys didn't already know, typically PA schools are 2 years in length. The first year is primarily going to be your didactic education. So that's going to be spent in the classroom and, just learning all of the different, parts of medicine. So in the first semester, you're typically going to take classes like anatomy and physiology, a little bit of pathophysiology, some of the basic sciences, and these are basically your building blocks for the coming semesters. So these are classes to really pay attention to because this is going to be your foundation. Later in your education, like the following semesters of your didactic year, you start to learn more clinical skills and technical skills. So how to talk to patients, how to take a patient history, how to perform these physical exams. And that's where it gets fun. Honestly, that's the reason why we're all here, right? And then you start to learn about treating patients, and this is the medication that we're going to prescribe, and all these different pharmacological things and different types of treatments. And then you also learn about behavioral medicine and mental health as well, which is great. In your second year, that's where you start clinical rotations, and most programs they let you rotate in primary care or family medicine. They let you rotate in surgery, women's health, peds, also behavioral health. And then you get your choice of 1 or 2 electives. You get to be like, oh, I'm really interested in surgery, or I'm really interested in dermatology. And depending on the program, they'll find you placements there. So that's the basic PA curriculum. If you want to move on to the next slide. Thank you.
Okay, so this was a fun slide to make because we had to deal with pictures instead of just a bunch of words. So, we were asked to describe a typical week in PA school. And for those that are familiar with PA school, the phrase drinking from a fire hose is often like passed around because it's not that PA school content is difficult. It's the pace, and the pace is honestly kind of ridiculous, especially in the first year. So I'll kind of break that down. I'll go into a little more detail. So we didn't break it down based on time. We just did morning and afternoon because you're in PA school from basically 8:30 to 5 o'clock, Monday through Friday. There's no breaks. You have a lunch. I'm sorry, you get a lunch and you're in there Monday through Friday. So starting off with Sundays, we like to organize what we're going to do for the week and maybe do some pre-reading, maybe do some grocery, just kind of get ourselves prepped and ready for the week. We eat lunch, and then we typically will maybe read up a little bit in the afternoon to kind of brush us up. Monday through Friday looks pretty identical. 8:30 to like noon, you're either in lecture or in lab. And now you can see here in the afternoons, we have it where there's like a little lab bottle that can flip. You can have a morning lab, you can have an afternoon lab. It really just depends, but you are pretty much there from 8:30 to 5 o'clock. And then you do get an hour for lunch, which is super, super nice. And then on Monday through Friday after school, so after like 5 o'clock, we would go home, maybe relax, eat a little snack or have some dinner, and then study again for like 2 to 3 hours. And, everyone's a little different. Some people don't do that, but we found in order to keep up, we needed to not only put in that 8 to 9 hour day, we had to add on another 2 to 3 hours afterwards. And this was mainly for the first semester or two, and it kind of eases up, but you are still in class Monday through Friday, like 8:30 to 5 o'clock. And then Saturdays, we like to keep for ourselves. So in the morning, we'll go out, get some sun, go hiking, go to the gym, take a run, walk the dog, something like that. I don't know why there's a coffee mug on this one, but
We still gotta
we
eat.
still got, I mean, we eat the apples and the coffee, I guess. And then, and Saturday afternoons, we typically study. Now we like to keep our weekends kind of flexible. So we know if we have a giant exam or 2 exams on a Monday, we'll study pretty much 8-9 hours on a Sunday and on a Saturday. But if it's like a light sort of week coming up, we'll just do a couple hours on the weekends. So it really just depends. But I think the best way to put it is like it becomes your Monday through Friday job. So that's a typical week in PA school. As you get further along, the lectures start getting swapped out for simulated patient cases, because at some point you've learned everything, not everything, but all of what the program wants you to learn, and then they want you to implement it. And that's usually like an OSCE or a simulation or some sort of physical exam checkoff list. And then the labs turn into suturing and ultrasounding and x-ray reads. So it's pretty cool as you get further along in the first year. So yeah. Kiana, you can go ahead and switch. Thank you.
Thank you. So now we wanted to touch on a couple of things we wish we knew before starting PA school. So the first one is PA school isn't really a place for competition. I think a lot of the time, I think especially in undergrad, I feel like we're all competing for placements in grad school, but PA school, we're already here. And I think one of the benefits of our program and smaller programs is that we all kind of form this family connection. And then you kind of realize along the way that we're not really competing with each other. We're all here to kind of lift each other up and get each other through this difficult time, right? PA school, the pace, like Jake said, is so fast. You're basically drinking from a fire hose, and, you really start to connect with, your classmates and realize that nobody's competing with each other at that point. The second thing is that the faculty aren't there to ridicule you or criticize you. They want to support you and build you to be the best PA that you can be. So initially, I don't know, it depends on the personality type, right? There are some people that are super sensitive to criticism, and that's really not a thing, not the kind of person you can be in PA school, or it's something that'll change in PA school, because you'll realize and you'll get criticized time and time again, and kind of become numb to it. And you'll realize that the faculty and all this feedback they're giving you to improve is just really for you to become better and be a better PA at the end of the day. And I would advise, like, don't take these things to heart. Just kind of focus on, being better at the end of the day. Next is definitely prepare your family and friends ahead of time. So PA school is fast paced, and, Jake kind of talked about our weekly schedule, and it's a lot of being in school and then coming home to study. And on the weekends, it's more studying, right? So preparing your family and friends, like, hey, I'm not going to be able to attend your wedding, or I won't be there for this holiday. I think knowing that ahead of time and knowing that this is a commitment and it's just going to be 2 years, and letting them know that as well is going to be super beneficial for you in the long run. Because I think for both of our families, they were kind of shocked that, like, we were gone and studying all the time. And I feel like had we given them more of a heads up beforehand, they would have been more receptive. So it's definitely important to prepare your family and your friends for the commitment you are making. And then lastly, it's not about having the highest grades or proving you're the smartest person in the room. This kind of ties in with the first tip, that PA school is not a competition. But I think along the way, you realize that C's get degrees. And I'm not, condoning that you don't try in PA school. Like I said, you want to be the best provider you want to be, right? And sometimes that means you won't get the best grades on an exam. Like maybe you're just not a good exam taker, but you're retaining the information really well. So it's not about really having the best grades or being, the smartest person in the room or always knowing the answer. It's about, how well you're taking in the information at the end of the day and how well you're going to be able to apply it. So as long as you're retaining and trying, I think you're going to be fine.
That was great. Yeah.
I think you can move on to the next slide, Kiana.
Oh, sweet. Okay, cool. And we finished with a minute after our expected. So yeah, I see the chat going kind of crazy. I'm not sure. How do you guys want us to answer these questions?
So I have the questions pulled up here.
We do.
So let's see, we'll do this one. So how did you remain involved in community service or volunteering during your gap years? We have a student trying to figure out how to balance both.
So staying involved. So that is a good question, because a lot of the volunteering we did was through our undergrad pre-health organizations. And what we ended up doing was contacting hospitals directly or contacting providers that we had worked with the pre-health organization and saying, hey, I'm no longer at this school. I'm not really with this organization right now, but am I still able to get these hours through you? Very similarly, that's how we got our shadowing done. It's really hard, especially during the pandemic, right? With COVID restrictions, to get shadowing hours. But I think the best thing to do is ask. The worst they can say is no. And even if you feel defeated, like, oh, I've asked a million places, keep trying. And even better is that there's outlets like this to virtual shadowing. That's a great opportunity.
Right. That's good. That's so good. I will keep that in mind because I'm pre-PA as well, and I am overwhelmed with how much information there is. But a question that I also had was, did you apply multiple times, or do you have any advice for anyone who is applying multiple times, and how can they not give up?
Right. Yeah, this is a difficult question because we know a lot of people that have, and there are a lot of people in our class that have applied multiple times. Fortunately for Jake and I, we applied one time, one cycle, and luckily we were able to get into the same program. But I know for a lot of people that isn't the case. And we have a classmate that actually applied to our program 3 separate times. And my advice, going off her experience, is just to not give up. There are so many people out there that, are continuing to try and try and try. And as long as with each cycle you're improving on, your healthcare experience and getting more hours and showing that you are still invested in this process, it'll come eventually. And I know that it's hard while you're in it to, keep your chin high sometimes, but just as long as you're focused on the end goal and as long as you still stay passionate about, pursuing the PA field, I think that'll come and show at the end of the day in your application every time.
So. Yeah, I agree.
Yeah, that's such great advice, and I appreciate that. I know many other students appreciate that as well. So my question and a student's question is, how do you two manage all areas of your life while in PA school? I think you briefly touched on this with your flexible during the weekends, but do you guys have fun?
Yeah. So yeah, I know. I really sold the PA program right there, right? Oh yeah, it's gonna be super fun. And I just don't want to tell you guys you're gonna have all this free time, because you won't in the beginning. So what you end up having to do is it's a crazy learning curve. The first time you get in there, you're gonna just be so overwhelmed. You're gonna say, I don't even have time to cook dinner. But what you end up doing is finding ways to compensate, right? And so, for instance, we love working out, we love hiking. So I really like to get into the gym. So I'll wake up 45 minutes earlier than I normally do, just so I can go to the gym for a little bit. Even just 30-minute walk, run, whatever is going to help me clear my mind. And so I'll set aside that time in the morning, or if I decide to sleep in, I'll set that time aside at nighttime. So just giving yourself at least, or not at least, but I would aim for an hour a day of just you time. You know what I mean? You or your family, if you're a significant other, and really try to be a normal person for a little bit. But don't get into the habit of taking, I'm going to take the entire day off, because then you fall behind, you feel worse. So it's really about balancing and organizing your time, your schedule. The weekends, definitely use that as a time to be normal. We were able to go to a wedding or two, just so that like you guys know, like we were able to fly home. We also had an odd situation because we were in Zoom that, we weren't required to be in Reno for some of it. So it really just depends. But just try to stay organized, try to stay prioritize what's important. If you have a big exam coming, maybe don't go to that rodeo or something, So yeah, that's a great question.
Yeah. Oh my gosh, I lost my train of thought real quick.
We have like a million questions.
Oh, I know. I have so many questions. So many questions. So what was the application cycle like for you guys? Like, how many schools did you apply to, and how did you choose the University of Nevada?
Right. Okay. So this is a good question. We initially wanted to apply super broad, right? Like this was our first application cycle. We weren't sure if we were going to get in. So we tried to apply to as many schools as we could. And we had about 15, 20 on our roster that we wanted to apply to. But we started submitting, because the application process for some schools is rolling. So we ended up, at the end of the day, we applied to, I think, like 8 or 9 programs out of the ones we were interested in. And then I think by that point, once we had submitted those 9, we had already started to interview and we got our first acceptances. So that's when we started to stop. So
started to stop.
Yeah.
And I'll kind of jump in here. So, a big question is, why'd you choose UNR, right? Nevada, Reno. And it's because we looked at it and we said, why do we want to be providers? Why do we want to be PAs? And really it came down to serving the state of Nevada. Nothing against any other states, but we grew up in Nevada. We grew up down in Las Vegas, actually. And if you look at I'm pretty sure Dr. Fowler's aware of this, but if you look at the list of worst healthcare in America, I think we're 49 or 48, a really bad. And it has to do with the growing population of Nevada and limited providers. They just opened up the second MD school in Vegas 3-4 years ago. So up until 4 years ago, they had one medical school. Our PA program is only 3 years old. And then they had one DO school down in Vegas to serve the entire state. And so it's, and if you do the math, right, it's just, there's not enough providers.
Yeah. We have a lot of schools here in Texas, of course, name the city, Houston, Dallas, San Antonio, but still our healthcare challenges, especially I think we have one of the highest rates of the uninsured in the United States. And so we have enormous healthcare challenges here in Texas.
Yeah. And so the thing about being a PA is that that's one thing that's in talks is it's a great way to bridge those healthcare gaps, especially for rural communities. And I know that if you talk about Las Vegas, everyone sees the strip and whatnot, but there's hundreds of miles of desert and rural communities up north. And, when you drive from Vegas to Reno, you see them and there's not a single hospital in sight. And so as a PA, as PAs, we're hoping to be able to serve those peoples and help them not have to drive 2-3 hours to just get a checkup, and so it was really important for us to serve the state that we grew up in. And ZDogg MD. So he actually spoke at our little PA conference, not little, but it was the national PA conference, and he's a big PA advocate. And so we appreciate him, and his podcast is great. He had a great segment on constipation recently, and it was hilarious.
A question that I had, and I saw that a lot of students also had, was what is the exam schedule like? What is that like? You said previously that you may have an exam, 2 exams on a Monday. How do you balance that out? Because as a biology major, I had 3 exams in a week. I can't imagine having multiple in a day.
Right. So it really depends on your program. So our program runs on a semesterly schedule. Other programs run on a block schedule. So for us, we have exams every Monday, every single Monday without fail. And that was one of the shocking things for us going into grad school was that in undergrad, we had exams maybe every other week. We were bio majors too. And I don't know why we had exams every 2 weeks, 3 weeks. And going into PA school, our exam schedule just became so like frequent that we were kind of trained to always be studying. So that's kind of our experience. I know other, schools, pending if they're block schedule, they have multiple exams a day and multiple exams a week even. So it really just depends on the school that you plan to apply to and what that schedule looks like. But for us, it's every Monday.
Yeah. It does slow down as you get further, but they swap out for like OSCEs. So like you're going to be interacting with the standardized patient and you have your proctor grading you on that. So it goes from like a 60 question multiple choice exam to, hey, can you interact with the patient and hit all the check marks that you need to, and also be human while doing it. So it kind of transitions.
Well, that's kind of great that it's every Monday, so at least like you won't be surprised as to when your exam will be. But
Right.
what say for example, if you do not do so well in a class, like maybe fail it, what is the process for that?
Okay, so this is one of those things that we didn't know prior to grad school either, is that the programs that you apply to, and I believe this is the same for nursing well, I wouldn't say nursing, I'm sorry, medical school, is that they don't want you to fail, right? They have things in place, they have programs in place like remediation to make sure that you have the chance to prove that you should still be in this program. And for our program specifically, it's, well, if you fail a semester, you have a week to remediate, and you basically, I think you just have a week to take these 1 or 2 exams. And if you fail that remediation, then you get kicked out, unfortunately. If you fail in 1 semester, you can pass a semester, but I believe if you fail 2 exams, then you remediate. So it's basically like, they give you a chance to make it up, even if you fail. They're very good at working with you. Your faculty will be very good at working with you to identify issues and where you're struggling. We had a couple of classmates that failed the first few exams and they were in danger of remediation, and they sat down with their counselor and they worked out what they needed, and they haven't been in danger since. One story comes to mind is that I had a friend who was just so distracted and had so much anxiety hearing everyone else typing or clicking on their laptops in the exam room. And the program put him in his own room and made sure that he was able to take the exam in a quiet space, which is like, I think that it's a small change, but it shows a big effort on the program side, like saying, hey, if this is what you need, we're going to do whatever we can to help you feel more comfortable during that exam taking process.
Jake, we have a committee here at Southwestern called the Promotions Committee, which is, you might say, is sort of backwards named. It's the kids that are struggling. Kid is a compliment, by the way. It's the kids that are struggling. They whatever the case may be. It could be alcohol, drugs. It could be. You hope not. But it could be just exactly what you said, that that typing noise, or they were great where they came from, but they were the best of the best where they came from. But in medical school, they're surrounded by the best of the best. And so the competition is fierce. Moreover, they've got to do great in school so that they can get into, the training later, the residency program. So the pressure is awful. And, oh, by the way, they may be borrowing $200,000 to go to school, and they've never had debt like that. You could buy a house with that. So anyway, we call it the promotions committee that tries to take each kid and set out a plan. And because what we're trying to do in our state, our medical school, is to make doctors for the state of Texas. And if one drops out, we have one less doctor. So it's very important.
And we appreciate that you guys have a program like that. And I think that's the important thing that I think you'll find across all med school programs and PA programs, is that they want to make the best providers possible. They don't want to accept you and kick you out, because that it doesn't help anyone. And so I think that's something important to keep in mind.
Yeah, and I've had this question multiple times, so I thought I'd just ask. Did you guys find it difficult to gain acceptance together, or did you get accepted into multiple? They think that we've had multiple students say it's great that you're doing this together. I agree. I think it's awesome to have support system.
Thank you, guys.
Yeah, we appreciate that.
So yeah. So like I said, we ended up applying to 8 schools, or 8 or 9 schools. All of them ended up being the same ones, not just because, we wanted to increase our chances of going to school together, but we also, both had that mission to work in Nevada eventually. And I think that like we had 2 interviews, right? And
Yeah.
the program that we're in right now is the only program that we both got accepted to. So, I mean, it ended up being like that was the option.
Yeah, and it's really cool that we got in together and we made this interesting post on Instagram. Just the odds are extremely slim to none. It's, if you do like the Venn diagram and A crosses over with B and like the odds ratio, whatever, where it overlaps. We did like a whole little post about that. But the thing that was interesting was we both interviewed down in Vegas.
Which
and
is where we're
then-
from.
Which is where we're from. And we wanted to go to Vegas because, how convenient would it be to just stay home, yada, yada, stay with parents.
Yeah.
And then, the next day we had an interview in Reno. So we didn't have time to really breathe. We hopped on a plane that night, went to Reno the next day and interviewed there. I got called a week later and got early accepted into Reno, which was like, oh my God, I got accepted to school. Justine hadn't gotten a call yet. And so we were saying, okay, what are we going to do? She then 3 days later got a call and got accepted to Toro, which is down in Vegas. So we're ready now. Okay, we're both in PA school. Whoa,
But just different places.
Different places. Are we gonna get in to the same place?
Yeah.
And then so what happened was I got an email. Hey Jake, you're on the wait list down here in Vegas. She got an email. Hey Justine, you're on the wait list here in Reno. So we both got accepted to different places, but waitlisted on separate places. So we're sitting there thinking, oh well, we have to move. Well, one of us has to move, aka me, and we got to figure out what we're gonna do. And so so the program started in June, up until about late April.
Yeah. They called me in April.
They called Justine. They gave Justine a call in April and say, hey, you got off the wait list. And so basically with like 2 months notice, she had to like let her program know when you had already gone to some orientation stuff.
Yeah. I had gotten all that paperwork done, paid the deposit.
Yeah.
I had to let them know that I was going to Reno instead.
Yeah. So we both decided to go to Reno, and we had a nice, and this is like, oh, maybe TMI for you guys. We had a nice little couple conversation like, hey, you don't have to follow me.
Yeah.
You can stay home. You can go to Toro, whatever you want. And we actually ended up deciding that the UNR program was a better choice for us,
right?
With what we wanted to do. Now, I think that kind of bridges to a couple of other questions we've been asked about why'd you choose UNR? And it really came down to, it's a small class size. There's only 24 of us. And we both learn well with like small class sizes. We get more focused on us. We get more help and you get a more family feel. We can pick up those skills a lot easier instead of getting lost in the crowd of 80 to 100 students. Another thing that we really liked was that the faculty was extremely welcoming, and they seemed like people that we would want to go to school with for 2 years with, as opposed, not to say anything bad about Toro, but they had a little bit of a different vibe, I guess you could say, a little more competitive, a little more hostile. And we decided like, ooh, that doesn't sound too fun.
Jake, that's a wonderful point, because I have to say that the other faculty and the residents and students that I work with, I just love them. These are people who pick people. Part of what we do here, I'm an old guy and a professor here, is we try to pick the people that are going to take over for us one day. But I think it's exceptionally important to go where you find people that you connect with.
Yeah, right. And, that kind of goes back to what Justine was saying about that, this program wants to impress you as well. They want to put on their best face for you and say, hey, if you feel like you fit here and we think you fit here, we all want to, it's a mutual decision, right? And then I think the last thing that I was going to say was that the UNR School of Medicine, the MD program, is a tier 1 medical school. And as a PA school that is an offshoot of that, we have the same faculty, we have the same opportunities for rotations. And so when we kind of boiled it down, we said, okay, what's going to give us the best experience clinically? And that was the program we chose. So those are like 3 major reasons we chose UNR. And once again, we had a conversation about that because we could have very well gone to just 2 different programs, but we ended up both deciding to go here.
Yeah, so great. That's Yeah, I really appreciate it. 'Cause I was curious too, but I'm glad someone asked because I wanted to ask too.
Oh,
It worked out. So
yeah, it really ended up being the best of decisions. And
Yeah.
it works out that we're together. So
So fun. So fun. So did you look at accreditation within each of your schools? Because I had a student that asked, what does provisional accreditation mean? I've seen some PA schools that say, but I'm not sure it would work if I started studying and then they lost accreditation. Sorry.
right. Okay, so this is a great question because our program is actually so new that it's still in provisional accreditation as well. That doesn't mean that they're not accredited, right? They're still, approved by the PA organizations to have this program. And provisional accreditation just means that they're not fully accredited yet. They haven't graduated X number of classes yet. But with that type of accreditation, you can still sit for the PA National Certifying Exam, which is the PANCE. So that's basically what it means. It means that the school is still in the process of becoming fully accredited. They're just new. And you still have the same opportunities to sit for the certification exams that you need to be a fully certified PA at the end of the day.
yeah, that's the major thing to keep in mind is if the program is brand spanking new and they aren't allowed to sit, like that's one thing. If you can't sit for your boards, that's a big red flag. And so we made sure we had a lot of conversation with our program saying, hey, when we are ready to take our boards, will we be allowed to get certified? And the answer is a yes. And to address the portion that was like, hey, what if we lose accreditation? So there's a lot of processes in place where it's not just like, okay, one failed review of your school or whatever exam, like checklist of your school, and you have no more accreditation. There's a lot of processes in place. A lot of things have to go wrong for that. And then, same token, if a fully accredited school has some issues with accreditation, there's a lot of programs in place to where they will make sure that they try not to strip that school of accreditation. So yeah, very good question, very big concern.
Right.
So it's understood.
Yeah. Thank you for answering that. And then I also had someone wanted to know, so you said you were biology, which is usually like pre-med. We also said that you could do other majors. Why did you choose PA over NP or MT?
All right, and this is the $1 million question.
Yeah, everyone always asks.
Do you want to take it? Do you want me to take it?
I think you prepared for this question.
No, I've just answered it so many times.
We both have answered this so many times.
Yeah,
so we don't mind being asked this question at all. I think for a lot of students, they have these same thoughts, right? Like a lot of people, go down the MD or they think they want to be pre-med, and then along the way they want to change their mind. So it's super common, and we appreciate the question.
So I guess I'll try to answer it as succinctly as possible. We were both pre-med, right? It was our dream, our goal to be doctors. And whether or not that was what we came up with ourselves or our parents' pressure, whatever you call it, that's what we knew out of undergrad, right? When you get out of undergrad, you try to apply to med school, but sometimes it doesn't work out and you take a year, right? And so I think that's pretty common. During that time, we thought, hey, wouldn't it be great to work in medicine? So it boosts up our application, yada, yada. Plus, I need some money. I was working at like a laser tag place at the time. You were working at Banana Republic.
Yeah.
Like none of that was looking too good for any application. So we said, hey, let's start working in medicine. I started working as a medical scribe, and over time, once again, we took three gap years. I was able to kind of get promoted to lead scribe, and I was basically managing accounts, and I was hiring scribes, training scribes. I was also hiring clinic accounts. I would go to different clinics and talk to the providers there, the doctors, PAs, MPs. Hey, do you guys want this scribe service? So I got to work alongside all types of providers and get to befriend them not only on a professional level, but we've been to birthdays, we've been to their children's birthdays. Like we got really close to these providers. And we got to see what their lives were like, and we got to see what their day-to-day was in practice. And when we sat back and looked at it and we said, what do we really want out of our futures as providers? And we really just aligned so well with that PA role. And once again, it's not really tangible. It's like when you know. And so when we both individually kind of at the same time really have the same, like the light bulb went off, like, hey, what do you want to do in medicine? what do you want to do in medicine? That sounds like we can do the same thing, but it's also like, look at how like our interactions with this PA, look at our interactions with this physician, and it really just lined up better for us overall. And for some people, they really like to hear more tangibles. Really a lot of it comes down to what you want for your future, how much time you want to dedicate, but also how you want to live your life. And some things that were common themes was the length of schooling, which is a big factor, not the only factor, and then work-life balance. You'll hear that a lot, that PAs generally have better work-life balance. Now, not to disparage being a doctor. We have a lot of friends who are MDs and DOs. We have a lot of uncles, aunts, parents, whatever you want to call it, that are physicians. But when we thought about it, it wasn't about, oh, we need to be a doctor because that's what we originally set out for. It's how can we do what we wanted to do and still get there and be happy there. And so that's ultimately why we chose the PA route. And once again, that's going to change for everyone.
Jake, I think the important question is what you just said, is that what do you want to do? And if you want to take some applied science that you learn and get involved in the lives of others to help them either stave off or hold back death, because that's part of what we do, either acutely or chronically, or to make their conditions better, you can do it in so many ways. Yeah. We have many PAs at Parkland that we work side by side, and they work essentially independently. We treat them a little bit like residents so that we talk the cases over. And to be candid, I wish more people would come up and talk cases over with me, because I learned so much. I was rereading hyponatremia, for example, today. It's complicated, and I wish I would have more people around to bounce stuff up. So anyway, our PA colleagues, we love them, and they are at the forefront of near independent practice in our ER. Can I ask you a question?
Yes, of course.
Are you a physician assistant or a physician associate?
Now that is brand new information.
Yeah.
I just wanted to pick your brain a little.
So I mean, I'm sure you heard the news, and I'm not sure who else has heard the news, but they voted to change the name from physician assistant to physician associate, until the states individually changed the laws
legislation.
And because there's all that fun, the numbers and the state legislature and all that. We're sticking with physician assistant, but in conversation and technicality, it is now physician associate. In practice, physician assistant. In school, physician assistant.
Right.
Until the laws in each state have officially changed.
And that, from what we've been hearing, won't be for a couple of years. So for now, it's going to be physician assistant, and then hopefully a couple of years down the line, most states and most places will change their legislation to adopt the associate instead of assistant. But
I fully support it. I think it's long overdue. I started med school 100 years ago, literally in 1973, and interestingly, it was quarters and not semesters in those days. And for the first quarter, we actually took our classes side by side with PAs and nursing students. The theory was that we were going to build the team approach from the ground up. And that was just and actually we would come back together periodically during the year. After the first quarter, we all went off to our separate courses and all. But that was a wonderful experience. And it taught me early on at a very young age how critical it is that we're all members of the same team. And in the final analysis, what we're trying to do is take care of people. And that's the truth.
And we love that, Dr. Keller. We truly appreciate that. And we hope that OTP can be a thing of the future. And at the end of the day, it only benefits the patient. It's not about who said what, who did what. It's what are the outcomes of that patient, and are you helping them, right?
And the parallel side of that is that it is not a license to learn what you've learned and then you will never learn anything else again. A commitment to medicine, whether it's physician, PA, NP, or whatever, is to continually study. Yes, I have a flip phone, but I'm surrounded by computers, both in the ER and and folks, I'm an old man near the end of my career, and I read all the time. I can't. Firstly, there's so much I didn't know. There was an article recently that said physicians stink by and large as far as rare diagnoses. We may have only heard of them, read a little bit about it, and never seen it. And so you know, anytime you ever think that you've learned everything when you get out of school, you're going to fool yourself because it's coming at you in a tidal wave.
Mm-hmm.
Well, I'm
Yeah.
sorry to interrupt. Keep going, please.
No. We appreciate.
You've been going exactly 1 hour. You want to get a sip of water or go pee, or you need to get up, walk around for a minute? We love what you're doing.
If the chat needs to take a break, we could take a couple of minutes and continue with the questions. We're okay.
Yeah, I
It's
think
up
we're
to you
okay.
guys.
It's really up to you guys.
Let's hear it in chat. You want to keep going? I like doing this because it typically well, we'll just keep going. But okay, there it is.
Awesome.
Yeah.
All right.
Sure, this is being recorded, so you guys can go back and this, you know, like a TiVo or whatever. I might have just
there you are.
I wasn't ready to hang up yet. So
looks like it's unanimous. Keep going. All right, rock and roll.
Cool.
Okay.
Yeah,
So go ahead.
I think that was the big question, right? Then we get that once again. We get that every day in our Instagram messages, and we explain the same thing. It doesn't change. I think that I'm listening and doing physics. That's great. Oh, physics. But yeah, no. So I mean, if we can elaborate more, that'll be great. If I'm sorry, if we can elaborate more, we're more than happy to. Once again, it really just comes down. I think I saw a cool comment there about soul searching from Diana. And yeah, that's what it is. It's soul searching. Yes. And like Dr. Fowler said, there's so many different ways to work in medicine and make a difference. I did want to add a little asterisk. Another great question we get is why not NP? Because right, a lot of PAs and NPs, although different, have a very similar practice capacity. And the main reason we didn't choose it is because for most of the programs that we were familiar with, you had to go to nursing school first. And, you know, we just didn't, we already had our bachelor's. We didn't really want to go back and get a, you know, BSN or whatever.
It would have been a whole nother going back to school. And we already like had biology degrees. So this just kind of seemed like the next step.
And, you know, I don't think there's anything wrong with being an NP. I don't think there's anything wrong with any route in medicine. I think if you're trying to make the world a better place and cure people and take care of people, God bless you. And then I've seen this question a couple of times. What is meant by OTP? OTP is optimal team practice, and very similar to what Dr. Fowler had explained. It's putting together a healthcare team for the benefit of the patient. So integrating better handoffs between nurses and providers, integrating better handoffs between doctors, PAs, and pharmacists. Even referrals out to PT, everything just becomes more streamlined, because I think there's a term that we hear often is called like loss to referral, or, you know, there's a lot of blaming done in the healthcare field, where it's like, oh, well, the nurse did this, and so it's not my fault. What OTP does is it really streamlines the idea of working to help the patient from a team perspective. And we are big supporters of that, but there's a lot of legislature and legality behind people not wanting that. And I think there's a lot of like the term might be scope creep or something like that. And it's for us, we understand, we get it. And I don't think anyone's trying to take anyone's job. We're just trying to make the healthcare system better, because frankly, we do believe that it may be fractured somewhat. So that's OTP in a nutshell from a couple of PA students.
Yeah.
So I just got a question here. It says, what is the best way to be competitive if you are lower in one area than another, such as lower GPA? Would you suggest doing a post-bac? I know, Jake, you said that you got one. Work on PCE and HCE. What do you suggest?
Right. So we think it's great to work on all of those areas. Like you said, Jake did a post-bac, not only to just increase his GPA, but get those prerequisites in mind. I think if you have a lower GPA, I think it's good to also, I think one of the main things you should focus on, aside from going back to school, is getting more patient care experience. So I know that for a lot of PA programs, they really take a look at, you know, how many hours you've worked in, you know, healthcare, how many hours you've worked working with patients. And I think that's one of the things that sets apart the PA field from, you know, maybe the MD field and, you know, other sorts of programs, is that they really look at the amount of hours you've worked with patients and been able to say that you've worked in healthcare. So I think that's one of the areas you can really focus on if you may not be the smartest person in the room, may not have the best GPA, because at the end of the day, it's not being, like I said, it's not about having the highest GPA. It's about how well balanced you are. And I think if you balance yourself out with, more patient care experience and being able to say that, you have learned a lot from this working as an MA or as a scribe, and you're, very competitive in that area, I think that works out. So you can turn those back if you want.
No, well, it's okay.
Okay.
And you pretty much covered it.
Yeah.
I have a question. So I know that from hearing from my friends and who are also pre-PA that sometimes they're a little hesitant to take a gap year, and you said that you took 3, which is so nice to hear. What made you want to do that? Do 3 instead of 2 or 1?
I think it's not that we wanted to take 3 gap years. I know that a lot of people are turned off by the fact that, they have to delay school for, another year and another year, and another year. But for us, I think it was so beneficial in the fact that we really got to figure out what we wanted to do. I think, after graduating from college, we both were still like, okay, I think we want to be at least for me, I was like, I think I want to be a doctor. And that's why I started to work, right, as a scribe. But that's when I, with that experience, I started to realize like, oh, maybe the PA path is what fits me better. And I think as negative as a connotation that taking gap years may have, I think it's really shaping to your path. I think the more you take, the more you're able to accumulate hours and be able to say that, oh, I really want to pursue PA. And I think for a lot of people, it tends to be enlightening that this is the way, this is the path that you want to take. And that's certainly what happened to us. Those 3 years that we took were definitely clarifying and, definitive. And we were able to make this decision to go to PA school instead of med school. So
Yeah, I think it's really important to know if you want to take a gap year, if you don't. Either way, it's great. And then I saw a question. It said, would you suggest doing multiple specialty practices as an MA, or is it bad to just stick with one? I think it's okay to stick with one, but what do you guys think?
Either are great. And we've heard the back from our faculty. So I'll explain kind of like what I mean by that. So if you stick with one, that shows your commitment and your professionality and your expertise in that field. For instance, I worked for 2 years in hand surgery. And so when it came to learning the hand and shoulder and all this stuff during anatomy, I was like the go-to guy because that was like what I did for 2 years straight. But being in multiple specialties also gives you the ability to be multifaceted once you get to learn these different things. So before I became a hand surgery scribe, I was working in general surgery, urology. I did some oncology. I did gyn-onc too, which was really interesting. So I got to like scribe for all these different providers and learn all these different treatment modalities and perspectives, which that was amazing. But that allows it. So it really just doesn't, one's not better than the other. But I would say for your own sake, for application, yeah, don't try to like be able to explain why you stayed in one place or why you jumped around. I was lucky enough to be in a company that allowed me to jump around, but it was still the same company. So yeah.
And then I had a question from a student. What is the best way to contact a foreshadowing? They tried cold calls, but haven't really heard anything yet. Do you have any tips? I know it's hard for me too.
Yeah.
I guess a tip that I would say is, honestly, I don't know how well this works currently because of COVID, but I would say walk into the clinic, introduce yourself, at least even to the front office, and, just kind of get a feel for those people and like have them get a feel for you. And, just ask like if they're willing to take on a student. That's the worst thing. The worst thing that they can say is no. And I think if the cold calls aren't working, the next step is probably moving on to like those in-person visits to the clinic. I know that's way more time consuming and that's a lot more effort on your part, but I guess at the end of the day, like if it gets you, to be able to get in there, And why not?
Yeah, and then I guess kind of a add on to that question is what, like, I know different programs have different numbers that they need for shadowing PCHC. What is the best amount, would you say?
As much as possible. um, so good question. So we'll break that down a little bit more numerically. So GPA, the average PA school requires like a 3.2. It's like, and that's not to say, oh, I have a 3.2, I'm getting in. That's the minimum requirement, as opposed to a lot of MD or DO programs, which is a little bit higher. So that's like a good thing, right? It kind of lowers that threshold a little bit. They still want to see a higher GPA, but if you can't quite get a 4.0, that's perfectly fine. Healthcare experience, PCE, we applied with a lot because of the 3 years. We've seen people with a few hundred, maybe 200-300 each. We've also seen people with thousands. Yeah, I said, we've had people who've worked for 10 years as a nurse. And so that, you multiply that out and it's like, oh, I have 10,000 PCE hours. And yeah, that's true. So that's for the hours wise, as much as possible. But if you feel you're ready to apply and you feel that you've gained the experience you need prior to becoming a PA student, out of where you worked, then whatever number is right is what's right.
Right. I think with our program, there was a huge range. Like there were some students that, applied right out of undergrad and they had like maybe 500 to 1,000 hours and got in. And, like we touched on this earlier, we had an audiologist in our class and he worked for 9 years before applying to PA school. So he had thousands of hours before applying. And, it really just depends on the program, but just as long as you feel prepared and you feel like, you are ready to move on to school, I think that it doesn't hurt to, apply with the amount of hours you have. If anything, like you will get more hours through the application cycle too.
That's
so
true.
Keep that in mind. You can always update CASPA with the hours that you're getting now, even if you've already submitted your application to the schools. So.
Yeah,
Quick little plug too. I was one of those that had like really limited amount of shadowing hours, specifically shadowing. So, cause I spent more of my time working and as a scribe than I did shadowing. So I applied with like 4,000 PCE hours, which is a lot, but I only applied with 100 hours of PA shadowing. So that's on the lower end. And so they look at your application as a whole, right? And so they'll say, okay, he only did 100 hours. Oh, but he did 4,000 here and he's working with providers all day. So we'll let that slip. You know what I mean? So if you're going to weigh in on one, feel like, you don't have to go, crazy on all sections. Just kind of try to be as well balanced as possible.
And then I think we'll do just a few more questions because it's starting to die down now. When does CASPA stop allowing you to update your hours? Do you know?
At the end of the cycle. So the CASPA cycle opens at the end of April every year, and it closes at the end of March the following year. So you can continue to update and update and update, and it'll continue to forward that information to the schools that you sent your initial application to. So that's a good question.
This is my question. How do you deal with the waiting? Like the waiting from either an interview, hearing back, acceptance, because I don't know how I would deal with that.
You want me to take this one? Or you want to?
I can talk about this.
You take this one.
Because I got off a wait list.
Oh, yeah.
Yeah, and I was waiting and waiting. It honestly, distract yourself. Like try as hard as you can to distract yourself while you're waiting to hear back for interviews. And even, just to be able to hear if you got an interview, just try to distract yourself, continue working. And like, it's honestly so hard because I've been there, like we talked about, like how we interviewed at UNR, or our current school, University of Nevada, in October. And then it wasn't until April that I heard back from them that I had gotten off the wait list. So those months that I was just, sitting there wondering if we were going to be able to get into the same program, those were honestly super nerve-wracking. But just keep your head up, Try to keep yourself distracted. That's like the best you can do, honestly.
Yeah, I think we took a few trips to California, went to like the beach. I think we hopped a plane, went to New York at one point, and we just like tried to like ignore
Yeah,
what was
get your
going
mind
on.
off of it as much as you
Yeah,
can.
yeah. I mean, unless you're continuing to apply, then I would say like this is funny. After our Reno interview, we high-fived each other and we didn't talk about it. We said, "Great job," and then we hopped on the plane, went back home, and it was like, "Okay, what's the next one? Okay, we're focusing on this program now." And then once again, a week later, got a call. So once you get that, once you submit and you're waiting for that secondary, either work on the next one that you're applying to, or just take a break and take a vacation or something. Try not to sit there and think way too much.
Okay, cool. Sounds good. And then I think you previously talked about interview tips, but was there anything else you wanted to touch on that?
Justine talked about that, and there was one topic that she made, and I think because I don't know when to shut up sometimes. And so when I was interviewing, I was just cracking jokes. And I think that like my faculty just remembered, like, dude, you were the guy that was just like, you weren't stiff. You were just like making jokes. You were comfortable here. You felt like you already belonged. Like I wasn't overconfident, but I kind of deal with anxiety by telling jokes and just chuckling along. And so, I don't go in there and be like, oh, I have to do everything exactly like this, exactly how I rehearsed it. Just get in there, smile and wave, shake a few hands, and just, it's another day. Once again, it's not all that serious, even though it really is, but just try to think of it as as an experience that'll make you a better person.
How did you prepare? I know there's lots of books out there, and I think you mentioned like this 300 question thing on YouTube. Can we get the link for that also?
Yeah.
Yeah.
We'll look it up real quick.
It's actually on Amazon. It's a book by Savannah Perry.
Yeah, she's cool.
She's a PA, and she has made all these great books. So let me pull it up right now.
Do we have a copy here?
We did.
We did, and gave it away.
Yeah, we did.
Okay. Another cool thing while Justine pulls this up, another thing that like you can do specific to like the PA interview is they're going to ask you about your prior experiences. So start really thinking about those experiences. If you've either been working or when you're about to work, find a couple of stories that are like your go-to stories. For instance, that one where I had to disagree with the physician that I was scribing for. That one, I kind of had that one loaded up in my like suit jacket, ready to pull out. And I had not necessarily rehearsed it, but I figured out what it meant to me. I figured out why that was an important moment in my life, realizing that, hey, I'm not just someone who works under the doctor, I'm someone who wants to make this patient's outcome better. And like, I was able to explain that a little more eloquently than I am right now. During the interview, I've had a few cups of coffee at that point, but, look at those experiences that you've had, find specific patients that touched you, bar their name out of the story, but figure out those stories and have them ready to go. Figure out kind of look at the situation from the outside and say, why was that important to me? Those are things that you are going to want to have ready for the PA school interview.
Yeah, I put the link to the book in the chat so everyone has access. And honestly, this is the book that we relied on for interviews, and it was super helpful. She gives you tips on like what makes a good answer. And like everyone's going to have their own spin on things. And I don't advise that you like take everything straight from the book, but it's a good starting point.
And then we're just going to do a couple more questions before we end. So I had a few questions about finances and any tips for covering cost of living during PA school. Yeah.
This is like this question's I feel bad that we don't have a better answer, but basically you're going to take loans. I mean, unless once again you have people in PA school that have worked jobs and have real careers and have spouses that make money, and I have a few friends that are paying cash through PA school, which is insane, but they're a lot older and they've had real careers.
Yeah.
We're coming off of a few dollars an hour scribe jobs, so like whatever money we had was for flights to interviews, for our initial rent, but you're going to basically have to take out loans. Be smart about it. It's going to be weird. One thing we didn't know with loans is that they just wire transfer you thousands of dollars. And as someone who's never had that much money in my bank account, I was like, oh my gosh, we're going to Vegas, baby. But don't be like that.
Yeah. That was our first semester. And
yeah.
Now we've kind of figured it out more. Like we need to allot money for food and gas and, you know, all those other necessities.
You know, pull out the Excel, pull out the app. We use a couple of different apps, I think, to like organize your money. It's like called Good Budget, I think. And you figure out how much you need for grocery every week, how much you need for rent, car payment, yada, yada, insurance. But really just try to be on top of what you need and try to purchase only the necessities. Another thing I'm going to plug is having passive income. And that's not easy for everyone, and we're not great at it, but we're able to kind of have fun and buy, I don't know, eat sushi or something when we want. Because before starting school, I got into like investments and, you know, this, that, and the other thing. So whatever it is that you make money on, if you have a small business, if you day trade, whatever it is, keep doing it if you can. Don't let it get in the way of your school. But at least you have like, oh, hey, I want to go to the movies this weekend, or, well, sorry, COVID, but you know,
right. And
I want to do something.
Yeah, I know you talked about loans, but there are other ways that you can also get school repaid for too. So I don't know if you guys have heard, it's National Health Service Corps. They actually pay, you know, they pay back some of your loans, and that's an opportunity if you guys want to look into that as well. But we don't really have that much experience with that.
Yeah,
so
we're still navigating those waters, but yeah.
Oh, oops, I was muted. And then finally, our last question is, do you guys know what you want to do for electives, or what you want to specialize in more before you give your closing remarks?
It's so hard. I love all these different things, but right now, this week, I'm like kind of on this women's health kick. Like, I think that's what I want to choose for some of my electives, at least, not just because I have a lot of experience in that area, but I think especially in Nevada, it's one of the things that are super underserved. And, you know, I am a female, and like, that's kind of an area that I feel is lacking in and I want to give back to. So this week it's women's health, but honestly, as a student, I feel like everyone's interests are always revolving because, you know, we're learning so many things and just finding out new things about different specialties. So
I felt an interesting phenomenon when I was in school. I found that with every rotation I took where they were nice to me, that's what I wanted to do. Because there were some where they were not very nice to you. You know what I mean?
Yeah. I'm like, oh, yeah, I don't really want to be there. And then, yeah, for me, I'm really interested in doing some type of surgical subspecialty or even just general surgery. There was a great question. I think Dr. Fowler answered it, but like, what is the PA's role in surgery? Most cases, you're going to be working as first assist. And in my experience, that's been the case. And so if you're working with general surgery, you go to every surgery, you round you do your own rounds and you check on their wounds and whatnot. And then in clinic, you're allowed to do like small procedures like cyst removals. Some derm PAs can do, I think, like shave biopsies and stuff like that. But it really just depends on whatever it is that your supervising physician allows you to do and trains you to do, then you can do it. You're never really, though, standing in the OR alone. And Dr. Fowler, if you'd like to jump in and add whatever you said earlier, that'd be great.
No, precisely. You know, I like the change to the term physician associate. It sounds a little bit like you're in business together, which you, in a way, you are. But I think that, you know, we're all committed to a common theme. I know I sound kind of corny, but it's the truth. I mean, that's what lasts over time, is that you were there to serve the needs of someone who needs help. And we do it as members of a team. We get to know each other, understand each other, respect each other. You're going to find things that irritate each other. And, you know, you work on those kinds of things. And over time, you build an alliance with that commitment that it gives wonderful care. So you two guys are great. I'm just really excited for y'all. What is the typical estimated income for a PA?
It changes per state. In Nevada, it's the average income is anywhere, I think it's between 110 and 120,000 a year. We also know that if you work in the ER, that can go up to $200,000.
Yeah.
And it really just depends. I know some states it's on the lower end too, so it really just depends.
Mm-hmm.
And then that's what's huge about being a PA too is that you have to negotiate, right? Because you do have to get hired at a clinic or hired at a hospital, and it's easy for new grads to get like, blindsided, I guess, but when they get hired, it's like, oh, you could have argued for more, you could have asked for benefits, this, that, and the other thing. But the average salary it's usually north of six figures and usually below $200,000, but it's in that.
If you two guys are hanging and both of you are making 150 grand, if you can't live on $300,000 a year as a couple, what's wrong with you?
Right, that's what we were saying. Like, I think like we've had this conversation before. Like we were doing fine as scribes. Like when we're actually like providers, like we're gonna have extra money that like I don't know what we're gonna do with, but
yeah, I'm still gonna be buying Chipotle for dinner. So
yeah, I don't think we're gonna experience such a lifestyle change and like eating off of gold plates and utensils, but we'll see.
Paper plates work just fine. And
yes.
as my old pappy used to say, everybody else is eating steaks, we're eating hamburger, and there's nothing wrong with hamburger.
Well,
you guys are great. Kiana, you have a last question or no?
I sadly don't have another question. I just have to say that I know I and a lot of other pre-PA students, especially the ones that are still on here, are so thankful that you guys could come and talk to us. This was so informative. And if you haven't done so already, please hype them up in the chat. They deserve it. Thank you so much for taking time out of your day to do this. Do you have any closing remarks? And I saw your question. They do have a Instagram. Please follow it. It's the cutest thing ever. They have lots of tips and tricks for being a PA student and relationships and all that fun stuff. So please check them out. It's at the PA Babes. And yeah, thank you so much. And you will be hearing from me again.
Of course, we really were excited for the opportunity to speak to all of you guys. And, when you did that initial presentation with us, we were just so impressed with, what you guys are doing with virtual shadowing. So we honestly are so thankful for the opportunity to be of help to all of you guys. That's kind of what we wanted to do, like on Instagram. Like, we know how hard it was as pre-PAs to kind of figure this out on our own because we didn't really have that many mentors or that many people to talk to about the process. So we've always just wanted to be able to give back. So
we want to say thank you to everyone that showed up. Thank you for the opportunity, guys. And honestly, we look forward to working with you all as on a professional level in the future. I'm sure we're going to see you all there.
Right.
Thanks again. Yeah.
Well, Jake and Justine, typically we had about nearly 100 online with us tonight. Typically, we'll have between 1,000 and 2,000 students that will actually watch the presentations posted online, including this one tonight. Each one of them will be a healthcare provider and see 100,000 patients in a career. A couple of thousand times 100,000 is $250 million. So you two tonight have touched $250 million lives through your sweet demeanor and lovely commitment to what all we're doing. So I just want to thank you so much.
Thank you again so much. And, there were a bunch of questions in the chat and even, questions prior. And if we didn't get to it, you can always reach out to us. Our emails are on there and then our Instagram is on there as well. And we're always, willing to help. So.
Well, be careful what you wish for because you'll probably get some emails. But again, thank you all. Kiana, last words?
Just make sure to check out if you enjoyed this session and you want to learn about other specialties, we do have a PA spotlight tomorrow in orthopedic surgery at 7 p.m. Central Standard Time. So check that out and that will be for credit. But that's all I have. Thank you guys so much.
Thank you.
Thanks everyone for coming. Have a great evening. Good night.
Bye, guys.
Thank you.